The Deadly 9. What every heart patient needs to know about these foods. Hi, I'm Christian from Cardiac Rehab Online, and today we're looking at the Deadly 9. If you don't know about these, you need to know about these, and you need to know about them now. Watch this video to find out what these everyday foods can do to you and why they're in the Deadly 9.
Okay, so the first of our Deadly 9 is sugar. Now, sugar seems to be in so many different products nowadays. It's especially important to look at the labels. So we don't need to be concerned about what the front of the package says when we're looking at processed foods. It's the back and the ingredients section that we really need to look into, because there can be often very many health benefits marketed on the front, but actually when you look at the back, the ingredients list tells a different story. So that's where we need to be looking. And when you look at the back of the packet and you see the ingredients which are first on the list are the ones that are most prevalent. And then the ones that are last on the list, there's the least of in that product. So if there is going to be some sugar in some products, then you want to make sure it's as far down the list as possible, because we really have to monitor the amount of sugar that we're having in our diets. So the problem is really with the hidden sugars is that there's so many of them in our diet where we just don't realize that they're there on a daily basis, that it really raises the sugar levels in our blood, and therefore the body has to produce insulin to combat these sugars. Now, if this happens over a consistently long period of time, this is how type 2 diabetes results, and also contributes to obesity as well. Both of those things, type 2 diabetes and obesity, will give you a greater risk of heart disease in the future. So we need to ensure that we're paying attention to what type of sugars we're consuming. Now, everybody loves a sweet treat, and it's fine to have something sweet in the diet, but maybe we can get it from alternative, more natural sources. So something like stevia, honey, or maple syrup would be good options to swap out for the sugars. So let's keep checking the labels and try to reduce the amount of sugar that we have in our diets on a daily basis. Okay, so number 2 in the Deadly 9, fake fats. Now, there's a lot of information and what I would say misinformation on how fats work in the body, and are they really the culprit when it comes to heart disease. But anyway, that's a conversation for another time. Today, we're just going to look at the fake fats. So here we have a picture of butter versus margarine. Which one do you think is better? Well, let's have a look at the margarine, for example. Now, the margarine has hydrogenated trans fats in it, which are known to cause heart disease and a number of other health-related issues in the body. And if we compare this to the butter, then this is a fresh food, natural food that's been used for generations, for thousands of years by people all over the world. And I would say that this is considered a safe food to eat. Everything in moderation, of course. But we can also choose coconut oil, and we can also use lard as well. And yes, it is high in saturated fats, but are saturated fats really that bad for you? And what about the health-giving properties that saturated fats contain that have been overlooked for many, many years? And I guess that's a video for another day, because we can go pretty deep with this topic. But just to say, on the fake fats, we want to make sure that we're avoiding hydrogenated and trans fats as much as possible, because the hydrogenation process of the polyunsaturated fats, when they're heated, artificially binds to them. And the trans fats actually become a different molecular structure to natural fats. So when they're heated, they actually resemble plastics. Now, these are known to raise blood cholesterol dramatically. And they're also added to long life foods. And as we show here, the example is margarine. So I would suggest that you choose a bit of real butter versus having margarine often. That would be a healthier choice. Number 3, processed meats. The chemical processing of our modern foods or food-like substances mean that we are consuming ever-increasing amounts of food additives, preservatives and chemicals, which are not meant to be in our food or bodies. When they accumulate, they can result in health issues. For example, phosphates, which are commonly used in food, increase fibroblasts, which result in hardening of the arteries. High sodium, for example, in foods leads to kidney disease, which is linked to coronary vascular disease. Eating these processed meats daily can increase the risk of heart failure by an estimated 38%. So what can we do about it? Well, one solution is simply to eat better quality food without the preservatives, the chemicals. A good example of this is ham. So if you go to the supermarket and you're looking for a packet of ham and you pick up maybe 2 different packets, one is a commercially processed ham and it has about 20 ingredients in the label. 5 of these in this label here are sugar or sugar derivatives. Alternatively, we can pick up some organic ham or naturally processed ham, which only contains ham and salt, a natural preserver. So which one is better value for you, and also which one is better for your health? As we can see, not all meats are equal and shouldn't be tarred with the same brush. Find good quality organic foods where possible, or naturally processed foods with the least amount of ingredients, and that way you can ensure that it's a healthier choice. Number 4, stress. So we're probably all well aware by now the relevance of stress when it comes to our health and well-being. And stress comes in many different forms. It can be nutritional, or can be from relationships, financial, work-related, environmental, and more commonly stress from devices such as phones, computers, in the form of EMFs, or what's known as electromagnetic frequencies. Now, the body doesn't care where or what type of stress it's dealing with. It simply just responds to it by summating all of the stresses and having a biochemical reaction to that in the form of stress hormones called cortisol. When our cortisol increases and stays elevated or prolonged for periods of time, it has a serious detrimental effect on the systems of the body, and especially that of the cardiovascular system. The effect of these prolonged stress levels on the cardiovascular system often results in inflammation, which creates little fissures or cracks in the arteries due to the prolonged stress on the system. So the body then, in its innate wisdom, plugs these little fissures or cracks with cholesterol, which helps to sustain the integrity of the cardio system. Over a long period of time, this fatty wax-like cholesterol can build up if the stress is not dealt with, resulting in coronary heart disease. So it's essential for us to be able to deal with the major stresses in our lives. We need to cultivate a healthy daily routine where we're able to de-stress, relax, rejuvenate all of the systems of our body. And above all, we must get a good night's sleep, as this is when most of the growth and repair takes place. So the main problem with stress is that it disrupts our hormonal system. And the solution to deal with it is to identify the major stressor and then create a plan to deal with that stress. But in addition to that, we also need to cultivate a daily routine that helps to allow us to de-stress, such as Tai Chi, meditation, relaxation, exercise. When we incorporate all these factors, can we effectively deal with stress on a daily basis? Fibrinogen is a substance in the body that helps the blood to clot. High levels of fibrinogen combined with high levels of LDL cholesterol, research has shown that you're 6 times more likely to have coronary vascular disease than if you have high levels of LDL cholesterol and low fibrinogen levels. So, what causes high levels of fibrinogen? Inflammation, of course. And what causes inflammation in the body? Stress. Increased inflammation in the body is recognised by C-reactive protein in the liver. When this is present, a correlation has been identified with increased coronary vascular disease risk, and this accurately predicts the rates of heart disease, diabetes and strokes. To bring down the fibrinogen levels effectively, we need to reduce the inflammation in the body. This means we need to take time out to reduce stress and also look at identifying any offending foods that you might be having an intolerance to. Also reducing inflammatory foods, very often grain products, dairy, alcohol, sugar are the main culprits. So eliminate these from the diet to help reduce inflammation. Number 6, homocysteine. If your levels of homocysteine are high, then you're 3 times more likely to have coronary vascular disease. Homocysteine injures the arterial wall and fatty substances accumulate, circulating immune cells known as monocytes rush to the site of the injury, causing inflammation. Arterial cells proliferate in an effort to heal the lesion, causing plaque to form on the vessel lining. The problem with this is that excessive clotting can diminish blood flow to major regions of the body. This lack of blood supply to the heart may cause heart attacks and lack of blood supply to the brain, which accelerates the development of dementia and may lead to strokes. You can get your doctor to analyse your blood to see what your levels of homocysteine are. So, what are the symptoms of homocysteine? Pale skin, weakness, fatigue, tingling sensations in the hands or arms, legs or feet, dizziness, mouth sores and mood changes. Most people who have a high homocysteine level don't get enough folate, also called folic acid, vitamin B6 or vitamin B12 in their diet. Replacing these vitamins often helps return the homocysteine level to normal. Other possible causes of high homocysteine level include low levels of thyroid hormone. A poor diet that is high in sugar and carbohydrates can deplete these key B vitamins and magnesium. If an individual has got health issues, they can have poor absorption of these key nutrients, which can result in high homocysteine as well. Number 7, gum disease. Periodontitis, commonly known as gum disease, has a direct link with increased coronary vascular disease. So, symptoms of this are gums that bleed when you brush your teeth or floss, bad breath, changes in the position of your teeth or loose teeth, receding gums, red, tender or swollen gums, build-up of plaque or tartar on your teeth, pain when chewing, or tooth loss. So what's the most common cause of periodontitis? It's typically caused by poor brushing and flossing habits or general oral hygiene that allow plaque, which is a sticky film of bacteria, to build up on the teeth and harden. In advanced stages, periodontal disease can lead to sore bleeding gums, painful chewing problems and even tooth loss. Now, a solution to this is obviously good oral hygiene. So that means brushing and flossing every day. But also a healthy diet is important. You can also add in certain supplements to help with this as well. So there's CoQ10, vitamin C and omega-3. These are all good options to help with oral health. Number 8, chromium. Chromium is important in the breakdown of fats and carbohydrates in the body. It stimulates fatty acids and cholesterol synthesis. They are important for brain function and other body processes. Chromium also aids insulin to break down glucose. Symptoms of chromium deficiency may include weight loss, confusion, impaired coordination, and a reduced response to sugar, which can increase the risk of diabetes. Treatment for chromium deficiency is quite simple and may involve chromium supplements. How much chromium do you need a day? So the recommended daily amount is for men about 35 and for women about 25. After the age of 50, it decreases slightly to 30 for men and 20 for women. So what foods are highest in chromium? So meat, and of all meats, lean beef contains the highest amount of chromium with 2 micrograms per 3-ounce serving. Wine, like its non-alcohol cousin, grape juice, contains high levels of chromium. Brazil nuts are famous for their rich nutrient content and also contain chromium, and whole wheat products. You can supplement with chromium. Be sure you take it in the AM rather than PM, as it has been known to affect sleep. And lastly, number 9, exercise. Now, the problem with exercise is that most people aren't doing any of it, or at least enough of it. And it's recommended that heart patients do at least 150 minutes of cardiovascular exercises per week. So that's the equivalent of 3 times 50-minute sessions. In addition to this, extra strength and conditioning exercises may be incorporated into a routine. Household jobs such as washing, cleaning the car, hoovering, gardening, etc. are all great activities to keep you active, but they do not compare to following a structured exercise routine. Your health and fitness will improve at a much greater rate by scheduling in specific cardiac rehabilitation sessions.
So guys, thank you for joining me today in this video. I hope you enjoyed it. Maybe you can take some points from that video and implement them into your daily lives and try to improve your health and well-being that way. In health and happiness, I've been Christian from Cardiac Rehab Online. See you next time.